This is a diagram that is very, very educational related to TMD. And it basically shows most of the common signs and symptoms of things that TMD patients suffer with. And there's different categories. There's like 8 of them. Head pain or eye problems, mouth discomfort, teeth, throat, neck problems, jaw problems, and ear problems. There's lots of stuff that TMD causes, and it gets very confusing because these things also influence other specialties, the eye doctor, the ENT doctor, right? The neurologist. There's just lots of doctors, the physical therapist. All these other professionals get involved, the chiropractor gets involved, and nobody very often understands what's going on because they don't see the whole picture. This diagram comes from the work of 3 doctors, Bruce Kinney, Lawrence Funt, and Brendan Stack. And Dr. Stack is in color here because when I first started lecturing, Dr. Stack was alive. He wanted to edit the current book that I'm writing, and I'm still writing it. I'm getting close to it, and it's the etiology of temporomandibular disorders. In other words, the causes of temporomandibular disorders. Um, and I had that opportunity of working with him, but I just never got around to finishing the work in time for him to see it. So we're going to start with head pain and headache, which is very common in almost all our TMD patients. Well, all women. Men sometimes will beat themselves up and just not have the headache. But the first pain that we see is forehead pain above the eyes, below the hairline, or sometimes up to the top of the hairline. And it can be both sides at the same time. It's very often confused with what they call frontal sinus pain, but it's not frontal sinus pain. Headache pain that is on the temples, on the side of the head, is extremely common. There's a muscle there that guides the lower jaw, and it's very often confused with migraine. And a lot of patients think they have migraine because they're having pain where migraine usually occurs. But no, there's a dental muscle there, and so headache at the temples is very often a TMD headache. The third is it's a migraine type headache. Isn't that crazy? It gets very confusing because migraine and TMD is usually muscles. Tension type headache is the name for this type of headache, and it is muscles, whereas migraine is typically thought of as being caused by blood vessels. Where you cut, you bleed, blood vessels. Migraine is inside the head. That's why we have this diagram showing you inside the head, whereas TMD is outside the head. And unfortunately, most physicians, they don't actually touch you. So if I squished on the side of your head, that's a muscle because it is the migraine type is on the inside of the head. But many patients have the same type of headache that we see. Migraine, it gets very confusing. So next thing is sinus type headache. Remember now, the muscles of mastication, those are the chewing muscles. The chewing muscles cover the face, the lower part of the face, side of the face. And a chewing muscle, the beaver muscle along the side, it goes right over the sinuses. So when it hurts, you complain of sinus problems. This gentleman is having sinus pain on the side of the eyes, right below the eyes. There's also a muscle there, and there's several other muscles that are involved with TMD. Shooting pain up the back of the neck and back of the head is very common because when you have a temporal mandibular disorder, you tend to stretch your neck forward, right? You pull your shoulders forward and you squeeze the back of that neck, squeeze everything, and basically tie it off and cause all kind of problems. And the pain can be underneath the neck, or it could extend all the way up, straight up to the top of the head. Although it is not super common, we do see it occasionally, and that's when the hair of the scalp is painful to touch. You can't really brush your hair. It's a little uncomfortable. Got it? And that means that the nerves are very, very, very sensitive at times when they're not supposed to be. So that covers the head pain, headache, which is extremely common, very often responds to Motrin, Advil, and Nuprin, and migraine medicine doesn't work. So these are very interesting things because if you take the medicine doesn't work, you probably don't got the migraine. It's very interesting. So next thing is we're going to look at how TMD affects the eyes. A very, very common symptom that we see with most TMD patients who come into the office is pain behind the eyes. So very often both eyes, but sometimes one. This lady's right eye is painful behind the eye. So this is just an unfortunate thing, but it has to do again with muscular pain. TMD patients can have bloodshot eyes. Uh, it's not as common as pain behind the eyes, but we do occasionally see that. And this gentleman has bloodshot eyes on both sides on the outside. And then the eyes, this is pretty extreme, but bulging eyes. This particular person has a thyroid problem, but it illustrates and shows you bulging eyes. And typically TMD patients will have more white on the bottom than the top. And many TMD patients are sensitive to sunlight. This young lady's wearing shades, right? Wearing sunglasses because of the light sensitivity. So this is what is crazy because you have shades, light sensitivity, that's also migraine, pain at the temples, that's also migraine. So we're looking like very similar to migraine. And then very often people have a family history of migraine and they have a family history of what? TMD. And it is just so interesting, the connection, the same nerve also, trigeminal nerve. So it gets very confusing, and so often people are incorrectly treated for the wrong condition, or the two conditions play on each other. And we often say to patients that have migraine, do you get a headache before you get a headache? Now that sounds crazy, but in fact, musculoskeletal headache, muscle headache is achy deep, whereas migraine puts you out. It puts you in the bedroom. You cannot get up. You've got a day out, and you can't function at all. And so you get this headache that hurts, and then it kicks into something very dramatic. Those are two things at the same time. You can have both migraine, and you can have TMD headache also. We're going to jump over next to ear problems because they're extremely common in TMD. I would say that probably at least like 2 out of 3, 50% to 2 out of 1 out of 2 or 2 out of 3 have some sort of ear problem some way, somehow. And it's so interesting because most of our TMD patients have visited ear, nose, and throat doctors in the past. What's amazing is we are starting to see ENTs learning more and more about what I do. And get this, one of the first people to identify TMD was a ENT called Dr. Costin. So here we go. Let's take a quick look at ear problems. A very common symptom that TMD patients present with is ringing in the ear, hissing, buzzing, or ringing, and that is called tinnitus. And there are many different causes of tinnitus, one of which is the lower jaw jamming into the ear. It's a head-on collision, that bang. And this is documented. This is not a speculation. There's lots of written literature and scientific references related to the link between tinnitus and TMD. Many TMD patients have decreased hearing in one or both ears, but usually one. And we do a tuning fork test that on both ears. And sometimes people just amazed because the tuning fork will show there's slight decreased hearing on one side versus the other, and the patient never even knew about it. Uh, but that's just the beginning. So over a period of like 20 or 30 years of continued headbutting of the lower jaw into the ear, it can get more severe, and especially occurs with men. So ear pain, earache with no infections, one of the most common symptoms also. That's why it's so important to go to an ENT. ENTs know how to use what they call an otoscope, which is a instrument to look in the ear. And they can read and see the eardrum and what's going on. General practitioners, they don't pull up an otoscope every day, and they may not be as careful and understanding and be able to diagnose as well. So very often you'll get antibiotic when you don't have an ear infection because the general physician is not as adept and able to use the otoscope, whereas a ENT uses otoscope every single day. He's a pro. So it's always better to pay just a little extra money and go to the doctor who specializes in in ear, nose, and throat because your diagnosis will probably be more accurate. ENT is not going to give you antibiotic when you don't have an ear problem. Clogged, itchy ears, sometimes with lots of earwax, will occur. And some people have said that, itchiness is like a type of pain. Sounds crazy. It's like pre-pain. It's a symptom that pain may later occur. But itchy ears is something that we see, and clogged up. Again, the wax is made as a response to the damage that the lower jaw is doing to the ear. So one of the next things that we see with TMD patients is vertigo and dizziness, and it's put into the ear section because it mimics, in other words, it looks like it's an ear problem, but it's really not. Got it? But it is the same symptom of dizziness, vertigo, instability. You can't walk. It's very difficult. You feel unsteady, and this is common with TMD patients. The next thing we're going to do is take a look at neck problems. Almost all TMD patients have a neck problem, really, for real. You have to be able to put your body up against the wall, your head on the wall, and try to side bend without twisting your head. And I'm going to say almost all of them can't move to one side at all, hardly, or very limited, other than kids, because children do have TMD, but kids can move a little bit better. And then some people have what they call hypermobility syndrome. And even though they do have a neck problem, they can stretch better. But lack of mobility and stiffness is common. Side bending of the head is the most common problem that we see. Very common to have neck pain because TMD patients try to stretch their joints. And so they stretch forward and their neck is twisted. And you can't, if you squat down and try to stay squatted, you can't. You're going to have a lot of pain with your legs. You have to straighten up and stand correctly. So neck problems, when you're stretching forward, the muscles just can't handle it. And it also causes pinching off of certain nerves in the back of the neck. Isn't that crazy? And some doctors, you'll go to them for these pinched nerves, and they'll inject those nerves with needles instead of relieving the trapping of the nerves, the pinching of the nerves from the TMD. And the next thing is just tired, sore muscles and related to the neck. So all the muscles in the neck are tired and sore and achy, and they just, a massage is fantastic. The problem with the massage is, guess what? It hasn't taken care of your TMD, has it? So then you, get this, you get the massage, you feel fantastic. Day later, you're back again. Why? Because you still have the TMD problem that's causing all of this. You never took care of the cause. The same thing is true with chiropractic adjustments. If it's the TMD that's causing the problem, it's causing the top vertebra not to balance correctly. So they put the top vertebra back into place at the chiropractic office, but then the TMD was never taken care of, so now it's unstable. Guess what? You felt better, comes back again because the TMD was never taken care of. So the human spine is kind of like dominoes. You know, when you hit a domino row, it goes all the way along. It's extremely common to see the problem of shoulder aches and, get this, back aches all the way down to the bottom because you're hunched forward in an attempt to protect your joints and your head. And you're twisting your body, and it creates a huge problem. The next condition in neck problems is pain that radiates down the entire arm and causes arm and finger numbness and pain. But it starts from the top of the neck. It starts from the neck being twisted due to the TMD. The neck gets twisted due to the TMD. Then it blocks out blood vessels. And so you basically cut the blood off to the arm, and it also pinches nerves. And the pain goes all the way down to your fingers. And a lot of times you'll have carpal tunnel surgery because that, they say, well, it must be that. And they do the surgery on you, and then 6 months later, you still got the same problem. And that's because the problem was not at the bottom of the arm. It was in the top of the arm. And guess what? The problem was due to the TMD. So you want to treat the TMD in order to get rid of the pain that very often will go away with proper treatment. We're next going to review on the bottom throat problems. It's hard to show you a diagram of laryngitis or swallowing difficulties without some video, so I just didn't put any pictures in. But the first two things in the throat are swallowing difficulties. Very often, TMD patients can't take a pill. They have to have a pill crusher, and they ask the doctor, can you give me the liquid form? Laryngitis means that their voice comes in and out when they're speaking, and that's because their voice box is hung off of the lower jaw. The lower jaw suspends it like a shopping bag. And so problems with the lower jaw will cause problems with the voice box and laryngitis. It is very common for TMD patients to have a sore throat and they don't have infection. They've gone to the ENT. Again, throat's ENT. We talked about ear, that's ENT, ear, nose, and throat. And it just feels like it's really bad, and you think you got a cold and you don't have a cold. It has to do with your TMD. Some patients have voice irregularities and changes in their in how they talk. Again, it's kind of like if you have a cold, it changes. But voice irregularities can occur. Again, why? Because the voice box, the larynx, is suspended by the lower jaw. If the lower jaw is twisted to the right or the left or backward, which often is backward, you're going to compress the voice box and you can't talk. We talk through our voice box. Many of our patients will cough a lot. They're constantly coughing, right? And they're clearing their throat because the muscles in the throat are stuck together. They're not pulled forward and suspended correctly, and they're not open. But you'll see frequent coughing and constant clearing of the throat. I think the last thing that we'll bring up is the feeling of a foreign object. Something stuck in my throat, doctor. So a feeling of a foreign object in the throat constantly, and you're not going to believe this. An ENT brought his daughter to me a number of years ago, and couldn't figure out what was going on. And it's so interesting, and he came in to my office, and we collaborated together, and I did the exam with the ENT, and he was like amazed because he was not taught any of the stuff that I was doing. I'm evaluating the throat from a different point of view than he did. And needless to say, we got his daughter healthy again. No more headaches. And he thought she had a brain tumor or something because they did an MRI and a throat problem, and we fixed everything. She went back to school. Life is good. But still, the collaboration has not occurred. It takes a long time for specialties to start cross-talking, and it's difficult because the ENT community is trained one place, and the dentists are trained another place, and then even the dentists don't know much about TMD because we only became a specialty in 2020. Get that? We became a specialty in orofacial pain in 2020. And TMD is part of that. Now that we are in a specialty, it is certain over the next 10 years, TMD will be taught to dental students, and dentists will become familiar with it. And a lot of people say, well, gee, shouldn't the orthodontist know about all of this? And the thing is, it's not taught in any of their programs, so they don't really learn about it. So the next area is jaw problems, and that should be pretty obvious because temples, mandibular, lower jaw, temporomandibular joint, jaw problems, right? So the mandible has a problem, lower jaw has a problem. A lot of people, dentists and physicians and physical therapists believe that you got to have clicking and popping in your jaw joint, and you don't. You don't have to have clicking and popping in the jaw joint in order to have a TMD problem. Got it? This skull here is very yellow, brilliant yellow at the joint where the temporomandibular joint is. And you'll hear clicking. You open your jaw, put your fingers on the side of your jaw, right where your temples are, right below your temples, in front of your ears, and open and close. You may hear some clicking and popping. Some people can hear the clicking and popping in the room when someone else is eating. And so that clicking and popping can be very, very quiet, or it can be very loud. And I've got grating sounds here. You see all that? This gentleman has his hands on his ear. It could be, you might think it's tinnitus, or it could be just a grating, crack, 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 zzz, sounds inside the joints. And that usually means that bone is rubbing against bone. God never meant for that to ever be. There's supposed to be what they call a little disc. Like, we have discs that slip in the back of in our backs. There's a little disc in the temporomandibular joint, the TMJ, and that prevents rubbing of bone. But sometimes you'll hear grating because the disc is damaged, thinned out, or what they call perforated. There's a hole through it, right? So, if you're clenching and grinding all the time, you're going to hurt, right? The muscles, the beaver muscle, if you think of a beaver, what does a beaver do? It's gnawing on wood all the time, right? It's just a busy beaver. And if you are abnormally clenching and grinding all the time, then the muscles that clench and grind are going to hurt. Makes sense, I hope. So you have pain in the cheek muscles, right? And the cheek muscles are a fancy name muscle called the masseters, and they're really strong muscles. They crunch and crack things so that you can eat and stay alive. But this young lady, she's placing her fingers over the front part of the masseter muscle. And so pain in the cheek muscles is also common in TMD patients. This is not as common, but I do see it. I have had people absolutely come in and their jaw's in constant motion. So look at people, their face is usually quiet and the lower jaw doesn't move. But there are some people that will smack their lips and move their lower jaw around. This young lady got her tongue out to the side. And this is a minority. We don't see uncontrolled jaw and or tongue movements very much. But guess what? When we treat TMD, very often it goes away. And I have lots and lots of patients, particularly denture wearers, who have temporomandibular joint problems, and they can't keep their denture stable, and they're just flying all over the place, and they got headaches. And then they have something called many ears disease, and it is really the lower jaw jamming into the ear. And you're not going to believe this. This is all documented by a famous ENT, Dr. Costin. So it is a problem because we don't have communication among the professions. But again, uncontrollable jaw and or tongue movements. The next area of problems that we see is in the mouth, right? And this is just a long list. There's 6 of different problems relating to the mouth. I think the first thing is just mouth discomfort. You're very uncomfortable. Your mouth is uncomfortable. It's sore. You're biting your cheek. You're biting your tongue. Everything's inflamed and sore. You've been grinding. The teeth are hot and cold sensitive. Everything just really hurts. And so even eating is a chore. And there's just general mouth discomfort. And we brought back this young lady to demonstrate 2 things: limited opening of the mouth. You can see how her mouth is shut, and if the muscles are tight. And if the muscles are tight, she can't open. And so it's very difficult. And then she can't open smoothly because she's fighting the muscles. So she's trying to open, but the muscles that close are so tight that there's a fight going on, and there's no smooth movement. So again, mouth starts 1, discomfort; 2, limited opening of the mouth. You can't open. And 3, inability to open smoothly. I can't demonstrate that. That's a movement problem. So we're going to give it to you. We're going to go on to 4, which is jaw deviation. So this is something that most patients don't pick up. And it's item 4, which is jaw deviation. Deviation means going off somewhere you're not supposed to deviate from the straight path. If we look at this young lady on the bottom, the red line, opening straight up and down, is normal. Opening straight up and down is normal. But if the lower jaw twists to one side, the white is deviating to the left, and the maroon is deviating to the right. These are abnormal movements. And so you can go in front of the mirror and open, and you'll also see sometimes that your chin is half an inch to one side or the other, usually to the left. And the whole jaw is twisted. Not only does it open and close improperly and deviates to one side or the other, but is twisted also. The whole jaw is twisted. I think that the next thing is a locked shut jaw or a locked open jaw. Locked open means you open really wide, you hear this popping, you can't close your jaw down. That is less common than locking closed or shut. So if you've had this situation where you woke up in the morning or during the day and you couldn't open your mouth. It was like you couldn't open, you struggled it, you couldn't do it. And you moved it around, you moved it around, you moved it around, then all of a sudden you hear a pop, pop, and then you open, okay? We call that transient locking. Transient means just a little bit, not all the time. Chronic means all the time, right? So if you have situations where you can't open and you have to struggle to move around to open, you have serious joint damage. There are little ropes inside the joint called the ligaments. The disc itself is supposed to be in the correct place on top of the lower jaw, right? There's something called a condyle in there. It's just a bone, and it's supposed to stay. The disc, the pad, that shock absorbing pad, is on top of the lower jaw. That disc is out of place. The ligaments are ripped and extended. There's still lots of stuff going on. When you see a locked jaw, locked shut or lock open, we've got some troubles. You really should be treated. You really need to come in despite whether you're having pain or not, because we want to support those joints so the ligaments don't continue to get damaged. I think the last thing is can't find a bite. And we have a dental model here. If you look closely, the teeth interdigitate. They fit together. They lock together. So when you bite down, your teeth lock into place. And that's important because when you chew, you're tearing up stuff. Like it's kind of like scissors in your whole mouth. Front part cuts like a scissors. The back part grinds things down. and that your teeth fit together. But TMD patients tend to have problems because they can't find their bite, and that's really abnormal. It's kind of like if you're walking, you can't walk. You're like, it's a serious thing, right? Oh my Lord, I can't walk. Well, if you can't find your bite, that means you don't know what's going on in your mouth. All of your nerves are kind of confused, and that needs to be corrected. So you can't find your bite very often if you have a temporomandibular problem. This is a poster, a diagram that reviews some of the most common signs and symptoms or problems that TMD patients have. And if you look at it, it has lots of different things, which creates lots of different problems. It involves headache pain, eye pain, mouth pain, teeth problems, throat problems, neck problems, jaw problems, and ear problems also. I think the final area that we see, again, these are the most common, not all, but the most common signs and symptoms of temporomandibular disorders. And the final one is teeth, which sometimes even dentists don't always know what the signs and symptoms are related to teeth. So the first thing is clenching and grinding at night. And a lot of times we say at night because people understand this. So while I'm sleeping, I don't know that I'm doing it. But have you ever seen someone shake their legs and then you tell them to stop and 10 minutes later they're shaking the legs again? They're doing this unconsciously. And if you look at people at the office or at home, they're very often clenching and grinding. You see the muscles tightening. And so clenching is holding your teeth together hard. Grinding is moving them against each other. Very often you can see very often on an x-ray, flattened teeth, because it starts even in childhood as early as 2 years old. If you hear a kid making lots of noise during the night, that kid is grinding. You start seeing that with the baby teeth, which they flatten the baby teeth. So when the adult teeth come up, they get flattened too. And there's lots of real reasons for this. So TMD is kids too, not just adults. So again, you're clenching and grinding, so you're actually shaking the teeth. You might have root canals, right? You might need root canals. You have sensitive teeth, hot and cold sensitive teeth that ache all the time. What's even crazier is some of the muscles that go into spasm and dysfunction and have problems will actually refer pain into the teeth, and you'll think that you have a toothache when you don't have a toothache, but you will swear it's your tooth. So if you have a heart attack, it's very common for the pain to go down your left arm. You go into the ER, emergency room, and the doctor says you had a heart attack. You say, doctor, you're crazy. That's my arm. My heart is in the middle of my chest. That's my arm. It's nowhere near my heart. And you're like, not understanding there's something called referred pain. So we do see hot and cold sensitive teeth. We see looseness and soreness of the back teeth. Get this. We see recession. We see actual gum recession. We see bone loss. These are the same exact things that are in periodontal disease, which most periodontists or specialists believe is caused by bacteria, an infection. But this is not. So you could possibly and go get surgery for an infection when you don't have an infection. You are clenching and grinding and beating the hell out of your teeth and all the bone supporting the teeth.